Moving forward in the chair. We all do this without thinking, pushing with arms to slide our bottom to the edge of the chair, and we don't need verbal guidance. There are 3 minimal assistance methods for the person moving forward in the chair. Firstly, we will cover the handler lunge position. The handler ensures the brakes on any wheeled items of furniture, equipment are applied. The handler asks the person to lean forward and away from them. It is best practice to request this when you are standing up. Avoid doing this whilst you are in the lunge position to reduce strain on your knees. The handler kneels on one knee to the side of the person, i.e. a lunge position, with the furthest leg from the person in front, using the available space at the side of the chair with the front leg. A pillow or kneeling pad under the knee may be needed. The handler places an open hand on the person's hip, nearest. The handler places the other hand on the side of the leg, just above the knee. The handler, on the instruction of shuffle in the command of ready, steady, shuffle, eases the person's hip towards the front of the chair by gently pushing the leg towards the side the person has leaned to, and at the same time gently pulls the hip buttock forward. The handler repeats this sequence with the other leg. The handler ensures the person is balanced and safe in the final sitting position, ensuring the person's feet are firmly placed on the floor. The second of 3 methods again involves the handler in a lunge position, this time using a small slide sheet to assist the person forward in the chair. If you have knee pain, the lunge may not be possible. Avoid kneeling on both knees, which causes housemaid's knee. This is also known as prepatellar bursitis. It is caused by inflammation of a small fluid-filled sac called the bursa in front of the kneecap. It more commonly occurs in people who spend long periods of time kneeling. Osteoarthritis will also be a consequence of repetitive kneeling. The handler ensures the brakes on any wheeled item of furniture, equipment, are applied. We would recommend its practice when the handler does not want to get too close to the person. This means there is some pulling of the slide sheet with the arms outstretched, which does mean this isn't ideal biomechanically for the handler. The handler, whilst standing, places the roller slide sheet behind the person down to their buttocks so that there is an equal amount of slide sheet exposed to the side of the person's hips. The handler kneels on one knee in front of the person, i.e. a lunge position. A pillow or kneeling pad under the knee may be needed. The handler grasps the slide sheet with each hand. The handler, on the instruction of shuffle in the command of ready, steady, shuffle, gently pulls the slide sheet with their left arm, assisting the person to shuffle their right hip forward. The handler, on the instruction of shuffle in the command of ready, steady, shuffle, gently pulls the slide sheet with their right arm, assisting the person to shuffle their left hip forward. The handler ensures the person is balanced and safe in the final sitting position. The handler ensures the person's feet are firmly placed on the floor. The handler removes the slide sheet. Tuck the sheet in the back of the chair if possible, or give it to a colleague. Do not put the slide sheet on the floor. The third method of assisting the person forward in the chair involves the handler standing and is indicated when you find lunging difficult and/or painful. The handler ensures the brakes on any wheeled item of furniture or equipment are applied. Due to the handler standing directly in front of the person in what may be considered in the person's personal space, the use of this technique must be preceded by a client risk assessment. Especially with reference to unpredictable or inappropriate behavior, neck or shoulder musculoskeletal disorders, as to whether it is practiced. This technique is only suitable for people who have sufficient cognitive function. The handler stands in front of the person with their feet shoulder-width apart, either side of the person's feet, which are hip-width apart. The handler instructs the person to place their hands on the handler's waist. The handler reinforces this coupling by placing their hands on top of the person's wrists. The handler instructs the person that on the instruction of shuffle in the command of ready, steady, shuffle, they are to shuffle their right hip, buttock, forward. To aid the person's understanding of which hip to shuffle first, tap their wrist and point to the hip on the side the person is first shuffling forward. The handler, on shuffle, steps back with their left foot, whilst maintaining the coupling with the person's wrists. The handler instructs the person that on the instruction of shuffle in the command of ready, steady, shuffle, they are to shuffle their left hip, buttock, forward. On shuffle, the handler steps back with their right foot, whilst maintaining the coupling with the person's wrists. The handler ensures the person is balanced and safe in the final sitting position, and that the person's feet are firmly placed on the floor.